Hello, good people of this great nation. Glad to have you join us on this maiden edition of NCDC Situation Room on the network service of Radio Nigeria. This brand new program is designed to create awareness on the subject of disease prevention and the level of the country's preparedness to ward off infectious diseases and control outbreaks. On this program, you'll also be learning ways to reduce your risk of exposure to diseases such as Ebola, meningitis, cholera, Lassa fever, and other infectious diseases. This is going to be an information hub when it comes to infectious diseases. So, make it a date with us every Monday at 5:30 p.m. on this station. If you want to know how a disease or virus is transmitted, here is where you need to be. So I say bring up your thoughts and questions and let's have this talk. It's NCDC Situation Room. My name is Abdul Fattah Otori and I'll be your host on this program. Trust me, while we educate and inform, you'll also be carried along fully on this program. We have different platforms where you can do that on social media. We'll also be coming to your neighborhood to find out how prepared you are to protect yourself against infectious diseases. Is your environment clean? Do you allow rodents and insects share your abode? How often do you wash your hands? Well, these are what we will be finding out from you. So when you see us at your neighborhood, be ready to share your opinions and comments with us. It's definitely going to be educative, factual, and revealing. So, I implore you not to miss out on any edition. My name again is Abdul Fattah Otori, and this is NCDC Situation Room.
Wetin be dis Lassa fever wey dey hear up and down so?
Dis na disease wey Lassa fever virus dey cause. E dey happen when person touch another person or rat wey carry dis virus poo-poo, wee-wee, spit or even blood, and e no dey send age o.
Abeg, how I fit take know person wey carry Lassa fever sef?
The sign dey show 2 to 21 days after person touch another person or rat wey carry dis virus. Dem fit dey catch cold or weak or get body pain or sore throat or dey vomit plus purge or cough or make their body no dey fit stay one place or make face swell up or make blood dey comot from any part of the body. Person wey get Lassa fever fit be like say na any other disease.
How we fit take stop dis Lassa fever?
No near rat, dead or alive. Keep your house plus area clean. Store water plus food where rat no go reach am. No spread food for road or even open place. Dey careful with the person wey get Lassa fever or the one wey Lassa fever kill. Make sure say you follow wetin government talk before you bury am.
Dem fit treat dis Lassa fever?
E better make you treat am early immediately you notice am. So no waste time o. Go the hospital wey dey near you immediately you begin get the sign. This message na with Federal Ministry of Health, the Nigerian Center for Disease Control, World Bank Ready Say Project, and UNICEF.
Thank you so much for staying with us. The program is NCDC Situation Room, and you're on to the very first edition of the program. Now, to start with, let me take you through what NCDC is all about. The Nigeria Center for Disease Control, NCDC, was established in the year 2011 in response to the challenges of public health emergencies and to enhance Nigeria's preparedness as well as response to epidemics through prevention, detection, and control of communicable diseases. Its core mandate is to detect, investigate, prevent and control diseases of national and international public health importance. Today on the program, we shall be looking at the country's preparedness to tackle disease outbreaks. Like a balanced diet, we'll have discussion on this topic. We'll also have a drama segment. Then we hear from you in the feedback and opinion segment. Then we visit the Situation Room. Get prepared to go on this ride. If you are prepared, let's take a journey together as we enjoy this short message in our drama flick. Enjoy it.
Usman. Yes, Adisa. You sounded like you have something critically important to share with me. Huh? I'm all ears. Chigaba.
Yes. You see, you are not far from the truth. You see,
I have not seen anything, Malam Adisa. Please, for goodness sake, say what you have to say. Because Bilkisu, my darling wife, just called me a while ago and announced to me that table is set for dinner. Haba, make I quickly go and chop my food before it's cold, mana.
Onje, you mean your dinner is ready at this time?
Yes, mana. We don't eat late in my house.
That is very nice. Let us go and deal with the food first now before anything else. Abi, When we come back, we can then talk. Abikilo fit.
No. I think that you should tell me what you have to tell me. And let me go and eat my food prepared for me and me alone by my one and only wife, Belkisu. It is for me and me alone, Mr. Adisa.
Usman. You are my friend now. You cannot do this to me. Oh yeah, let us go to your house now and enjoy the food together. Show me where there is love in sharing.
No, please. I just can't do that.
Okay.
When I mention now,
that means I should also withhold the information I have for you then. And it's about your wife's uncle, Malam Jato.
What is happening to him? Tell me now. I'm asking you a question. You're keeping quiet.
What
is happening to him?
You will know when we get to your house after we have eaten the dinner.
Okay, man. Let's go. That was what I was about to say. Let's go.
We are out there. Let's go. Usman,
no.
You are a wicked man. So you had wanted me to miss this delicious meal in the name of Kini? God forbid, though.
No, God forbid. But don't tell me you have no information for me now that you have eaten.
I have. Except that it is not a good news.
What is it? You are making my heart.
Let me tell you. You see, your in-law, Malam Jato, he set his house on fire in an effort to kill rat. Ekute, he wanted to kill Ekute that ran into his house.
No. Is this a joke? I decide you know I don't like a joke. Even if you will joke, will you joke with this kind of thing? Okay, how can he do such a thing? Is he all right? Wallahi, I don't think so.
That is the word for you. Usman, look. Who is this young man coming to your house?
Where is he? It is the community doctor. Dr. Chuku, you are here.
Yes. Good evening, sir.
Good evening.
Good evening, my doctor. So you are the new doctor in this community?
Yes, I am, sir.
Doctor, how are you?
Yes.
Look, I'm sorry I won't be able to stay here with you longer here, because I have to go and see my in-law whose house has get born.
Benyo, that's true, doctor. The man set his own house on fire in an effort to kill rat.
What? Rodent?
Benny.
Doctor, you are making my heart is doing dum. The way you're shouting is indicating that this is more serious than we can imagine.
Of course it is.
What do you know, doctor?
Look, burning of the house is about the least that could happen to any person involved in rat business. Because that rat you are seeing has the capacity to wipe off the entire community if it is not properly controlled.
Dokita Drono. I know your father very well in this community when he was alive. He was a very upright man. He never involved himself in anything shady. But I'm surprised at you, young man. How can you tell me that common rat, Eku, can kill a whole community? I think the white man's mentality has affected your medulla oblongata. And they will tell me something else.
I agree with Chipadisa. Is it not the rat that we have been eating before they even born you? How come you have suddenly become a threat to our lives and property? Doctor Chuku, think about it.
SARS. Have you heard of Lassa fever before?
Wait, Drono. Malaria fever, I know. Typhoid, I also know. Which one is Lassa fever again?
Adisa, I'm telling you, I've heard about it inside radio. Lassa fever is a killer of people anyhow.
Good.
One is very dangerous.
Very good.
Very. No, it's not very good. It's dangerous.
Okay. Good that you know.
Okay.
Lassa fever is caused by rats, and it is very deadly. When it strikes, it is merciless. It is no respecter of any status at all, whether you are old or young, health workers, and even relatives of victims. All are at risk.
Egbami, Modano. What do we do now? Abi? Maybe I should better leave this community immediately.
No, stop it. It's not by running away. Just keep quiet. Let Dr. Chuku just tell us by himself what can we do to prevent ourselves and protect ourselves from this Lassa fever.
Well, I must confess the situation is tense and dangerous. But my office sent me here to this community to educate you people on how to avoid contracting the disease and any other disease that may come up in this community for that matter. The most important thing is for us to observe very good hygiene in everything. Clear the bush around you and don't leave your food open to rodents, rats and insects to attack.
Shogbo, did you hear him, Malam Usman?
Yes, I did. Adisa, And why are you looking at me like that?
I just remembered that my father even said it, that we should avoid rat, that we should forbid rats.
I see. And you just remembered by yourself, Abi? Mm-hmm. So your father, did he tell you before he died or after he died?
I can't remember, but I know he said it.
And all this while you didn't remember.
Beautiful message there from the fleek. We do hope it would help your understanding of the matter. Well, as I told you at the beginning, we'd like to carry you along. So, talk with us through Twitter. The handle is at NCDCGov. On Facebook, it's Nigeria CDC. You can also reach us through a toll-free line, meaning you don't pay when you call. The number is 0800 9700 0010. Send message only to 0809 955 5577. We're also on WhatsApp. The number is 0708 711 0839. Please follow the numbers, no flashing. Make use of the platform of your choice. Just follow the instructions. Thank you. Now let's hear the opinions of the people as regards preparedness to outbreaks.
We are praying for no disease, but we are doing all our best for using sanitizers and what have you. We do wash our hands and make sure our environment is clean. We do sanitation in our compound. We clean everywhere, make sure there is no weeds.
Me, I am always proactive in any kind of disease. I make sure anytime my environment is clean, even my children's, I do teach them everything you touch before eating food. Wash your hand. If I bring food to the house, before you eat it, wash it properly.
You use antiseptics, at least to prevent yourself first, as a protection against any disease.
Lassa fever is very deadly.
Lassa fever is a type of disease whereby if you expose your remnant of food anyhow, if the rat now eat it and you go and eat it again, then you may contact it.
If you eat food, don't leave that place. Carry it into the drawer and keep it. If possible, if you are going to somewhere, if you're not going to wash it and keep it in the drawer before everything, because health is wealth.
It's normally happen when we are changing weather like this, change of season. Maybe we are changing mostly to Harmattan where everywhere will be dry and people will be burning bushes. Immediately you burn bush, those rats will leave their natural habitat to find their way to enter into our houses. And if care is not taken, we can contact fever, the Lassa fever through them.
Some years ago, about 30 years ago, I'm close to somebody that contacted the disease, vomiting and excurating.
If you are living in an exposed environment, you make sure you cover all your foods. Even you cannot avoid rat to be entering your house. And in case they enter, just make sure that you cover your food are well covered, that no rat will be able to open it, and you use strong metals as well to save your food. If you use plastic, the rat will still eat your plastic and eat your food. And once you now go and be eating remnant of food that you are exposed, and the rat has touched it, definitely you contact the Lassa fever because it's communicable through the rat, a particular species of rat.
Alright, now it's time to visit the Situation Room. Let's join Godwin Odemije as he takes us to the Situation Room. Godwin.
Oh, thank you, Abdul. Here in the Situation Room, we will be getting you situation reports on what is happening in the various states of the Federation, where NCDC has experts working on the ground. Today, we'll be talking with Dr. Lawan Bakari, a member of the Risk Communication Pillars, via the telephone. Hello, Dr. Lawan Bakari, and welcome to the program.
Okay, thank you very much.
Please give us an update in terms of a situation reports from the various states where NCDC staff are working.
As you are aware, there's a technical working group at the Nigeria Center for Disease Control that is leading on all efforts on Lassa fever. The technical working group has been meeting every Friday of the week since the beginning of the year. We don't miss the meeting. It is one of the most important initiatives towards coordination of the disease. So our situation report, which we publish on the NCDC website, the situation report of EPID week 45 reads thus. The first thing is, this particular reporting week, we've had a total of 559 confirmed positive cases from beginning of the year. So that means in January 2018 till now, we recorded 559 confirmed cases of Lassa fever. Of these, we recorded 143 deaths in the confirmed cases and 17 deaths in probable cases. Now, probable cases are those who died that we are not sure of the source of death, but we know there's linkage to Lassa fever. In the reporting week also, we want to let you know that so far we've recorded cases from 22 states, but most of the states, the states we've recorded most of the cases are Edo, Ebonyi, and Ondo states. And these three states have contributed a total of 83% of all of the confirmed cases. The remaining states of the country are recorded just 17%. It makes it important that these three states are like the hotspot for the activities at the NCDC in terms of coordination. We are working towards a very strong preparedness this year because we are edging towards the period of the outbreak itself, which is the dry season. So all hands are on deck to make sure that we support, especially the worst affected states, to be better prepared this year. Before now, we have pre-positioned communication materials with which the states can use in sensitizing their communities. And we've also reached out to the commissioners of health of these states to also start preparing their personnel and their commodities as is required, especially for activities related to surveillance, which will require early detection of cases by ensuring that anybody that has fever reports early at the health facilities. And if health workers suspect that they have Lassa fever, the states should be ready to quickly investigate. And in case where it is Lassa fever, they pick those cases and commence management as soon as possible.
Dr. Lawaz, I must thank you for coming on the program today. Thank you very much.
Thank you very much.
That is it from the Situation Room. Back to you, Abdul.
All right, thank you very much, Godwin. It's now time we meet our guest on this maiden edition of NCDC Situation Room. He's no other person than the Chief Executive Officer and National Coordinator of the Nigeria Center for Disease Control, Dr. Chikwe Ihekwazu. Yeah, it's good to have you on the program, Doctor.
Thank you very much.
Now, tell us, what's the Nigeria Center for Disease Control all about?
The Nigeria Center for Disease Control is a parastatal in the Federal Ministry of Health with a mandate to prevent, detect, and control diseases, respond to diseases of public health significance. Now, in our context, most of those diseases are infectious diseases. We have some priority diseases. We call them priority epidemic-prone diseases. There are 5 of them: meningitis, measles, yellow fever, Lassa fever, for the rest of the viral hemorrhagic fevers, and cholera. So our mandate is to make sure that Nigerians sleep well at night, and knowing that there's a set of people working to prevent them from having these diseases, and if they do have these, that we have the people, the infrastructure, the reagents in the labs to detect and respond. So I think in a nutshell, that's our core mandate, and we can go further in any aspects of how we operationalize that mandate at the NCDC.
Okay. NCDC has been in existence for a while. Could you count the impact the center has made in the lives of Nigerians in recent time?
NCDC is actually a fairly young parastatal. We came into existence in 2011, but I think we only came into the consciousness of Nigerians after our response, leading the response to the Ebola outbreak. That was really when people understood kind of our role. It took an outbreak of that size and the response that was then orchestrated through the organization, through the parastatal. But since then, we've gone on, especially in the last 2 years, to lead the response to several disease outbreaks. And what has happened since then is we have built our capacity to not only prevent, but critically detect. Now, when I say detect, I mean each of these diseases, actually to make a diagnosis requires a specific level of sophistication in your laboratory infrastructure. So we have moved to developing a new national reference lab on the outskirts of Abuja, so you can take your samples and make that diagnosis in country. We're digitalizing our surveillance system across the country, setting up EOCs across the country. So in various ways, we're slowly bringing up the agency to fully be in a position to fully operationalize its mandate. So Yes, we have succeeded in the Ebola outbreak. We continue to respond to others, but there's still a lot of work to be done to get us up to speed in where we'd like to be.
But doctor, we all know that controlling disease outbreak is a very big deal, especially in this part of the world because of some factors that may even be beyond the NCDC. So how prepared is the NCDC as far as response is concerned?
Preparedness is actually a societal function. What NCDC should do and does is to prepare all of us. Of course, there are things we have to do ourselves, but there are also things that the rest of society should do. So the first part of preparedness is actually knowledge, to inform the public on what they need to know themselves in terms of prevention, so that they understand the consequences of not being prepared and the consequences of not doing what they need to do themselves. So if you find heaps of refuse around your houses, if you don't take your child with a fever to get an appropriate diagnosis before treating. And so that's the first level, is really to inform the public on what the public needs to do. The second level is to inform healthcare practitioners in terms of what they need to do. So why it's important to always wear gloves when you're treating patients, why it's important to insist on a laboratory confirmation for malaria before treating, so that if it's not malaria, we can find it early and treat whatever it is. So the second level is really informing and making sure healthcare practitioners understand what they need to do for disease of public health importance. The third level is really where we come in, is to make sure that if a doctor then sees a febrile child and thinks this may not be malaria, it may be yellow fever, it may be Lassa fever, do I know where I can send that sample to get that diagnosis? So this is really what we've worked hard at doing over the last few years, making sure that we have a network of labs across the country where you can make that diagnosis, and in addition, ensuring that there's a mechanism to send the sample to the lab. So we now have a sample transportation system where in every state you have a number of a state epidemiologist, you call him, and we will actually collect that sample and send it to the appropriate lab. Now, the fourth level is where you now have found a number of cases of a specific illness, and you think this might be the beginning of an outbreak. So in every state capital, we're setting up emergency operations centers, which are basically rooms with communication equipment and where you bring all partners together to decide on how to respond. We have done that now in 8 states. We hope to get to 12 by the end of the year. So you can see that at various levels, the preparedness happens, societal level, healthcare workers, and our level. In addition, specifically in preparation for the Lassa fever peak periods, which often happens always happens in the dry season, first quarter of the year. We have already this year pre-positioned response materials, PPEs, treatments, ribavirin for treatment in all the Lassa fever endemic states. So we did that middle of this year, so we're not caught unawares again. Every state with Lassa fever cases has a good supply of materials already pre-positioned in their state capitals to enable the response. So these are a lot of the work that Nigerians often don't hear about, that happens quietly in the background, and making sure people are prepared. This year again, we carried out a Lassa fever training exercise in all the 6 geopolitical zones. Went with teams together with colleagues working at the Irua Specialist Teaching Hospital. With a big team here, we went around, organized big training sessions for clinicians all across the country. This happened very quietly, but that's how we want our work to be, that we want to quietly improve our capacity to prevent, detect, and respond.
Well, Doctor, in recent times, we've noticed that you have placed serious priority on Lassa fever. Well, before you get to talk to us about what you're doing in that light, I'd like to speak about what our level of understanding of infectious diseases is. Some people have said that we don't understand the genomics of infectious diseases, yet we're able to defeat Ebola. What would be your response to those who think that we don't have the capacities to do this work?
I really would encourage all of us to be less skeptical about our country. Yes, there are many things that are not as good as we would like them to be. We're all very much aware of them. But I think, and I'm sure because I experience this every day, there are pockets of excellence across our country. Within NCDC, there are people that are working hard every day to make sure we protect our citizens from infectious disease. Now, this is not an easy task. Sometimes people travel to rural areas for 3 weeks, for 4 weeks, are out there on their own, very little protection against the hazards of our country, doing quiet work diligently, trying to reach every child with immunization, with information, education, trying to get samples from cases. So I think, yes, we are not as prepared as we would like to be. I can't say we're fully prepared for every eventuality. If I say that, I would go home and sleep. But we are a lot better prepared than we have ever been. And this is not necessarily because of the buildings or infrastructure. This is really all about the people. And that people are really working hard on all aspects of the work that we're doing. And if you come here on a weekend, if you come here at 7 p.m. at most evenings, you see people working hard, making sure that we are in a position to protect Nigerians. And if we're faced with another challenge, like the Ebola outbreak, that we have an appropriate response.
Indeed. You at home, keep your home free of factors that can cause diseases by keeping your hygiene top-notch. Don't leave anything to chance. We must say a big thank you to you, the CEO and National Coordinator of the Nigeria Center for Disease Control, Dr. Ihekwazu. Thank you very much, sir, for coming.
Thank you very much. Yeah. Thank you very much for the opportunity.
That's the size of the program NCDC Situation Room for today. It's the maiden edition. I believe you learned something from it. If you did, please join us again next Monday, 5:30 p.m. is the time. Before then, reach us via Twitter. The handle is at NCDCGov. On Facebook, it's Nigeria CDC. You can also reach us through a toll-free line. That's to say you don't get to pay when you call 0800 9700 0010. Send messages only to 0809 955 5577. We're also on WhatsApp. The number is 0708 711 0839. Thank you very much. This program is a production of Gato Agency Limited under the sponsorship of the Nigeria Center for Disease Control, NCDC. Visit their website to know more about the center. It's www.ncdc.gov.ng. www.ncdc.gov.ng. Our appreciation goes to the management and staff of NCDC for their immense input to the program. The executive producer is Godwin Odemije. He also wrote the drama flick. Mobolaji Ajani is the producer of the program. I am Abdul Fattah Otori. Until I come your way again next Monday, ensure you live a healthy life. Bye for now.